Press in the cassette flow regulator to make sure it is closed and confirm that there is no flow during priming. Insert the piercing pin into the outlet on the fluid container using a twisting motion. Do not insert the piercing pin while the container is hanging above the infuser. Suspend the container on the IV pole. Squeeze to fill drip chamber to the score mark. Do not completely fill the drip chamber. If using a rigid fluid container such as a glass bottle, open the filter vent cover above the drip chamber. If using a flexible plastic container, make sure the vent cover is closed. Invert the cassette so the secondary port is pointing down. Slowly open the flow regulator by turning it counterclockwise while holding the cassette in the inverted position to allow the fluid to flow into the cassette at a controlled rate. Note: to quickly stop the flow at any time, push in on the flow regulator. When the first drop appears in the pumping chamber, turn the cassette upright. Continue to slowly prime the set until all air is removed from the cassette and the remainder of the tubing. Tap the cassette, Y-sights, and tubing to dislodge air bubbles. Note: if the filter at the distal patient end of the tubing gets wet, you must temporarily remove the cap to continue priming. Once the priming is complete, push in the flow regulator to close. Confirm there is no flow. Check the drip chamber and the distal end of the tubing to confirm that there is no flow and that no kinks appear in the tubing. If you observe flow or leaks, close all clamps and replace the administration set. Lift the lever to open the cassette door. Grasp the cassette by the finger grip. Slide the cassette between the cassette door and the door guides. Press the lever down to close the cassette door. For Plum360, insert the proximal line into the line A tubing guide.